United States, we've had formal review of screening in the wake of the NLST, and we have a B recommendation so that we're implementing screening under the Affordable Care Act. So in the United States, we're talking about how to do that and do that correctly. The rest of the world, including in Switzerland, they're still trying to figure out if screening is worthwhile. So it's kind of a different discussion here than usually back in the United States, which is unusual. But they're concerned about the cost of it. They're concerned about, what's the right population, how do you do it correctly, and whatnot. And I think that a lot of the research that's been done a lot of places, but especially in the United States over the last 10 years, has done really quite a wonderful job in delineating not perfect screening, but screening that's highly effective, is cost effective, and is associated with a very significant mortality reduction. The leading consortium doing screening in the world is the ILCAP, International Early Lung Cancer Action Project, which is now headquartered in Mount Sinai in New York. But they have, I think, follow-up of about 70,000 people from four continents, with 70 or so sites that have been screening up to more than 20 years. And they have done a lot of work, a lot of publications, including a lot of recent publications about how to do screening in a much more comprehensive way. A lot of that work has been looked at, and there's been lots of other people publishing as well. NCCN has done a really nice job of synthesizing that data and looking and building their recommendations in a dynamic way, looking at things as they evolve. In addition, the Lung Cancer Alliance, which is an advocacy group in DC, they now have about 400 members in the National Framework for Screening Excellence, which is again a self-assembling consortium of institutions that want to do best practices in screening, to do it in a multidisciplinary way, to do it in a way that's patient-centric, to do it in a way that brings best practice, dynamically to the fore. And they want the institutions involved with it to be very attentive to their looking at the results and figuring out, how to do this safer, cheaper, and faster.